rounds noong October 2019. Pero hindi pa po tapos ang ating laban against polio. Bagamat may pandemya, sisiguraduhin po natin na mapoprotektahan ang ating mga anak laban sa life-threatening na sakit na ito gamit ang dekalidad at siguradong mga bakuna. Sa mga magulang, may kapangyarihan po tayo na maging parte ng solusyon sa polio sa pagpapabakuna sa ating mga anak sa nagaganap na DOH Polio Immunization Campaign. Ang polio ay nakakahawang sakit na maisasalin sa pamamagitan ng contact sa infected fecal material or dumi ng tao. Atin pong ipapakita kung bakit ang mga bata ang siyang pinaka-at risk na magkakaroon ng polio kung hindi pa nila nakukumpleto ang kanilang bakuna laban sa sakit na ito. Halos 2 dekada na ang lumipas na wala po tayong nare-report na polio dito sa atin sa Pilipinas. Subalit dahil sa kakulangan po ng pagbabakuna laban sa polio at iba pa hong environmental factors, ang sakit na ito ay muling naging isang health issue. Sa kabutihang palad, meron na tayong bakuna laban sa polio at ito ay ligtas, epektibo at libre sa mga designated health centers. Ang susunod na yugto ng Sabayang Patak kontra Polio campaign ay nagsimula kahapon, July 20, at magbibigay ng libreng bakuna sa Mindanao hanggang August 2. Ang nasabing bagong polio campaign ay nagsimula na rin kahapon sa Luzon at panimulang target area sa Central Luzon at magtutuloy sa Laguna, Cavite at Rizal hanggang August. Si Undersecretary Abdullah B. Dumama Jr. mula po sa Field Implementation and Coordination Team of Visayas and Mindanao ang magpapatuloy ng mas detalyadong kampanya. Good afternoon po, Yusek Dumama.
Magandang araw sa iyo, Yusek Rosette, Yusek, at sa ating mga panauhin. Yusek Rosette, ang kasulukuyang Sabayang Patak kontra Polio po ay masaya at masiglang nagsimula kahapon, July 20. Nilalayon ng kampanyang ito na mabakunahan ng kontra polio mahigit kumulang na 3.5 million na mga batang hindi pa naglilimang taong gulang sa buong Mindanao. Base sa field reports ngayong araw na po na to, 634,832 na po o 8.3% na ng mga bata edad 5 taon gulang pababa ay nabakunahan na po sa unang araw ng kampanya. Lahat ng mga kinakailangan sa kampanyang ito tulad ng bakuna, vaccine carriers, PPE at mga iba pang mga gamit ay naipamahagi na po ng DOH sa iba't ibang probinsya, munisipyo at lungsod sa buong Mindanao. Ang handang-handa na po yung ating mga healthcare workers at volunteers. Napakalakas po ng suporta na ibinibigay ng mga LGU, kaya yung tinatawag ni local government officials at iba pang partners at malugod na tinatanggap ng mga komunidad ang kampanya ito. Inaasahan po natin na Yusek Rosette na makakamit natin ang target na higit pa sa 95%, yung layunin natin na 95% ng mga bata ang mabakunahan sa kontra polio.
Ako, magandang balita po yan, Yusek Dumama, no, na talagang nakapag-umpisa tayo at nung naumpisahan ay maganda ang turnout nitong pagbabakuna natin dito po sa mga areas na nabanggit natin. That is to ensure that all of our children will receive this vaccine para po maprotektahan sila dito sa sakit na ito. So Yusek, babalikan kita mamaya para sa question and answer natin. Ipapakilala ko muna itong ating ibang mga bisita sa ngayong araw. No? We have with us today Dr. Rabindra Abeyasinghe, the acting WHO representative in the Philippines. Prior to this, he was the coordinator for malaria, other vector-borne and parasitic diseases at the WHO Western Pacific region based in Manila. And also with us today is Oyun Dendevnorov, the UNICEF country representative to the Philippines since June 2019. She is responsible for strategic leadership and coordination of UNICEF's program of cooperation with the government of the Philippines. She has 20 years of experience and expertise in children's rights and development. Good afternoon, Dr. Rabi and Dr. Oyun. Welcome to our BIT COVID-19 virtual presser. I will give the floor to both of you to start your presentations. We start off with Dr. Oyun. Oyun?
Yusek Verhera, Yusek Dumama, Dr. Rabi, and to all those who are joining this press conference, good afternoon to all of you. I am very happy from UNICEF to join here to talk about the polio vaccination campaign. WHO and UNICEF, we warned of an alarming decline in number of children receiving life-saving vaccines around the world. This is due to disruptions in the delivery and demand of immunization services caused by COVID-19 pandemic. Let us not let hard-won progress in immunization be further undone by COVID-19. We at UNICEF are here to help the government's polio response, first by procuring vaccines, polio vaccines, and providing supplies. UNICEF has procured and delivered around 4 million doses of polio vaccines and printed and distributed around 230,000 IEC materials, as well as 370,000 face masks and 15,000 face shields for polio vaccination teams. Second, we have trained by today health and community workers in risk communication and community engagement and in infection prevention control. UNICEF jointly with the DOH have trained 615 people from the vaccination teams for risk communication and community engagement and 480 for infection prevention control. Last but not least, the UNICEF has also given technical support through development of the polio campaign guidelines during COVID-19 and assessment and monitoring tools, communication plans, and IC materials. We at UNICEF would like to reiterate that children have a right to good health. If we strengthen immunization and build back better health systems, we can end vaccine preventable deaths. Immunization is key in giving every Filipino child a chance to grow healthy, reach their full potential. We commend the Philippine government and the DOH for prioritizing immunization amid COVID-19. We urge the government to further strengthen primary health care services so that all children can not only survive but thrive. Together we can end polio, and I would be happy to respond to questions, if any, later on. Thank you. Back to you.
Thank you very much, Oyun. We will get back to you later after Dr. Rabi's presentation. So good afternoon, Dr. Rabi, and you can have the floor for your presentation.
Good afternoon, Yusek Roset Behere, and good afternoon, Yusek Abdullah Dumama. It's nice to see you after a long time, and good afternoon, Oyun. It's a pleasure for me to be here on behalf of WHO at this opportunity when the DOH, together with the regional governments, are recommencing the Sabayang Patak Contra Polio campaign. As many of you are aware, the polio outbreak was first detected in July 2019, and we had multiple rounds of polio vaccinations in Mindanao, here in NCR, after the detection of circulating vaccine-derived polio cases in these places. Unfortunately, the onset of the COVID pandemic meant that we could not continue with those vaccination campaigns, so that we completely stopped the polio outbreak and certify that the polio outbreak is finished. So we have now, with the ongoing COVID pandemic, also formulated how we need to restart and respond to this polio outbreak and work to finishing the polio outbreak affecting parts of the Philippines. Accordingly, WHO, together with UNICEF and our other global partners, have developed guidelines for safe administration of vaccines to children in the time of COVID. We are particularly looking at ensuring that all of the children at risk of polio in the outbreak affected areas are fully protected through the polio vaccines. But also within that process, we have made every effort to ensure that nobody, including the health workers, the vaccinators, the support staff, and the families are put at increased risk of COVID. For this, we have included in the campaign response several security measures to ensure that there is no or minimum opportunity for COVID transmission, while we ensure that all children under 5 years receive their polio vaccines. As you are aware, we are within this campaign round planning to vaccinate more than 3 million children across Mindanao and the Basulta Islands. But we are also planning to do vaccination campaigns in Region 3 and parts of Region 4A, where we have found evidence of polio virus circulation. So this will be a phased campaign which we started yesterday, and the vaccine campaigns will continue in different areas that I mentioned until the end of September or the 27th of September. WHO, together with UNICEF and the DOH, will work with the regional departments of health and our counterparts to ensure that maximum coverage are reached. A minimum of 95% coverage is necessary for us to interrupt transmission. We are very happy to note that under the DOH's guidance, many regions during the previous campaigns at the end of last year reached levels much higher than the 95%. In fact, some regions even reached 99% coverage. And so irrespective of the COVID challenge, we urge everybody concerned to give their best to ensure that we achieve high coverage. And may I make use of this opportunity to appeal to parents and caregivers and guardians to ensure that all children under 5 receive their vaccinations in areas that the polio vaccine campaign or the Sabayan Patak Contra Polio is carried out, so that we have high coverage and we can interrupt this transmission of this polio outbreak and certify the outbreak over. Thank you very much.
Thank you very much, Dr. Rabi and Oyun. I will get back to both of you later for some questions coming from our televiewers. We will just go to Yusek Dumama first. Yusek Dumama, bakit po daw napaka-critical na matugunan natin ngayon ang polio gayong mas malalim tayong problema katulad ng COVID-19? Yusek Dumama?
Yusek Cruzet, alam niyo po na napakahirap at napakabigat yung laban natin ngayon sa COVID-19. Kailanman po, di po natin naranasan ito. Datapwat ganito ang ating kalagayan, dapat nating unawain at bigyan ng pansin at ang mga iba pang mga nakakahawang sakit na patuloy pa rin naghahasik ng lagim sa gitna ng pandemya. Nais kong ibahagi na ang iba pang mga vaccine preventable diseases po o VPD ay hindi nawala o tumigil sa pagkalat ng dahil sa COVID-19. Kabilang ang Pilipinas sa tinaguriang polio-free country na sabi na po kanina ni Ma'am Oyun yun, na humigit kumulang 2 dekada po ito, Yusek Cruzet, 2000 hanggang 2019 po. So balit nung nakaraang taon, sabi ko nga kanina, muling nakita ang polio virus sa ilang kabataang Pilipino at maging sa ating mga kapaligiran. Ano? Simula June 2019 hanggang February 2020, meron na po tayong 22 na human polio case sa Regions 3, sa Region 4A, Region 10, Region 12 at Barn. Meron din po tayong nakitang circulating polio virus sa waterways sa mga ilog ng Maynila at Davao City. Kaya po ang DOH ay hindi nag-atubili at agarang nagsagawa ng malawakang sabayang patak kontra polio. Dito ang polio, dahil po sa pangyayari ito, alam po natin ang polio ay napakabilis makahawa at maaring magdulot ng habang buhay na pagkaparalisa o kamatayan. So simula po nung August 2019 hanggang February 2020, nagkaroon na po tayo ng mga siyam na polio outbreak immunization activities. No? Maalala ko, may 4 sa Mindanao at parang 5 beses po sa NCR. 1.4 million na bata po sa NCR at 3.4 million na bata sa Mindanao na may edad under 5 years old po. Samantalang meron din pong ilang piling lugar may mga batang edad 10 taon pababa ay nabigyan ng life-saving polio drops na ito. Nais nating manatiling malusog at maliksik ang mga kabataan upang sila ay maging kaagapay sa pagbuo ng isang maunlad at matatag na bansa. Napakahalaga po na may pagpatuloy ang bakuna ng oral polio vaccine at iba pang bakuna laban sa BPDs kung ayaw po natin magkaroon ng panibagong outbreak sa gitna ng kasalukuyang pandemya. Magiging dobling dagok po sa ating lahat kapag yun ay nangyari at di po natin hahayaan yun. Kaya po, yung sa sabayang patak kontra polio sa Mindanao ay gagawin ho natin ng buong puso at para ho sa kabataan ng ating bayan.
Thank you, Yusek Dumama. So napaka-importante ho talaga. So sana po sa pamamagitan ng mga ganitong impormasyon, nahihikayat po natin ang mga magulang na pabigyan po ng bakuna ang kanilang mga anak. Lalong-lalo na po ngayon na sinabi nga ni Yusek Dumama, hindi po natutulog yung ibang mga viruses o ibang mga sakit dahil may COVID. Nandyan pa rin ho sila at maaari pa rin maapektuhan ang ating mga kabataan kung hindi po sila magpapabakuna. Yusek Dumama, meron po ba tayong nakitang maling perception tungkol sa polio na kailangan po natin bigyang linaw?
Okay. Yusek Cruzet, nung mga nakaraang rounds, meron tayong mga ganung pangyayari tungkol sa mga maling impresyon sa bakuna. Kabilang na po dito yung mga ilang paniniwala ng iba't ibang sektor at iba't ibang kultura o relihiyon. Subalit, ang bilang ng mga bataan na bakunahan ang magsasabi sa atin na ito ay nagbago na. Sa katunayan po, nung nakaraang mga SPKP rounds natin, kada round po sa Mindanao ay mayroong mga 3 milyon o mahigit ang nabakunahan na po. O kaya yung last po ay about 99.7%. Mga nakaraan, umabot po tayo ng 98%, pero 99.7% po yung pinakabago. So, yun po ang magpapatunay na mukhang nalampasan na po natin yung mga challenges na ito at napaintindi na po natin sa ating mga kababayan ang kahalagahan ng bakuna.
Napakaganda ng sinabi nyo, Yusek Dumama, So talagang sa paulit-ulit lang natin na pagbalik sa mga tahanan, sa mga mapaalala natin sa ating mga magulang, ay naiintindihan naman po at tinatanggap din itong mga serbisyo na kailangan ng kanilang mga anak. So may I now go to Dr. Rabi. Dr. Rabi, what is the outlook for the polio response in the Philippines over the coming months? Dr. Rabi?
Thank you, Yusek Roset. And this is an interesting and difficult question because this time's polio response is happening in the era of COVID. We have been very happy with the leadership provided by the DOH in facilitating the Sabayang Patak Contra Polio campaigns before the COVID outbreak started. We are now challenged with an ongoing outbreak. Fortunately for us, where the response is happening, we are now in GCQ or MGCQ, and so we can continue response campaigns. And we are hoping that we can achieve good coverage and interrupt the transmission, as I already mentioned. But a lot of this depends on how the COVID outbreak will continue to evolve. So as we work with DOH and counterparts to support the polio response, we are also working to control the spread of COVID. And the outlook looks very good if we can complete and reach the high coverage that is aimed with the Sabayang Patak Contra Polio campaign. So I think we have shown previously, both here in NCR and even in Mindanao and the BAM, that we can have very good campaigns reaching beyond 95%. And so my message to everybody concerned during this campaign will be let's give everything we have to achieve that high coverage, and that will mean that we have a very good outlook and we can interrupt transmission of polio in the country. Thank you.
Thank you, Dr. Rabi. It's really a challenge to have this kind of campaign, especially in this kind of situation. But as you have said, you are enjoining everybody to, give their best effort so that we will be able to reach those children that we need to cover for this vaccine. So, Oyun, some Filipinos are concerned about potential adverse effects of vaccine on oneself. Is this something to be concerned about when it comes to the polio vaccine? Oyun?
Thank you, Secretary, for the question. As UNICEF, I want to convey, to tell the parents that the vaccines are effective and vaccines save lives. We want to convey that the immunization protects children from harmful and very highly infectious diseases such as measles, diphtheria, polio, and others. While there is misinformation circulating about vaccines, the fact is that except for very rare cases, there are no negative consequences of being vaccinated. When children are vaccinated, they are not only protected, but their immunity protects the other vulnerable members of our communities who are either not be able vaccinated or cannot be vaccinated, such as newborns or people who are sick and who don't have a strong immune system. So I would say that vaccines protect children against harmful diseases and deaths, and we save millions of children every year globally.
Thank you, Oyun, for that information. So I guess there's nothing to worry about the adverse effects of these vaccines to our children, because definitely, as you say, it's very safe and it doesn't have that much adverse effects. So may I hear your final thoughts on regarding polio and our campaign? May we start with Oyun, and then we'll have Dr. Rabi, and then we'll have Yusek Okang. Oyun?
Yeah, with the first rounds for polio vaccination, with the DOH Secretary Duque and all other technical partners, colleagues, and WHO, Dr. Rabi and other teams, we have been communicating this message, but I would like to reiterate once again that we at UNICEF would like to urge parents, caregivers to please take your children to get vaccinated during this round of polio campaign. And whether or not your child was vaccinated or not vaccinated before, please just get your children vaccinated. And I want also to say that health workers are trained on the infection prevention control. Those who are concerned that during the COVID there might be transmission infection, I tell as UNICEF that we have been training medical staff, community health workers, how to use personal protective equipment to help prevent the spread of COVID-19. And they are fully equipped, and vaccines, as I said, safe, effective, and the vaccines are free of charge. Every one of us has a very important role to play in protecting children from vaccine-preventable diseases. Let's all work together to keep our children safe and healthy. Let's get all our children vaccinated who are supposed to get vaccinated against polio. Thank you.
Thank you very much, Oyun. Dr. Rabi?
Thank you, Oyun, and thank you, Rosette. So one final message. We have shown that here in the Philippines, we can achieve high coverage and we can interrupt transmission of the polio virus. We are now in the final round of vaccination for Mindanao and the BAM. We have completed the vaccination rounds in NCR, and we have to do vaccination rounds in Region 3 and 4A in the affected provinces. The campaigns conducted at the end of last year before the onset of COVID have shown that we can achieve high coverage, that we have good cooperation from the public. So we urge all parties concerned, the healthcare workers, the volunteers, the parents, the caregivers, to ensure that all children under 5 years receive this additional dose of vaccine so that they are fully protected from polio virus. We can work together and interrupt the transmission. So let's join hands and do this and overcome the challenge of polio as we also fight to control COVID. WHO, together with UNICEF and DOH, is fully supportive of all the regional health departments and all our partners in making this campaign a success. And we will work together with you to ensure that the Philippines is polio-free again. Thank you.
Thank you very much, Dr. Rabi. Yusek Okang. Yusek Dumama.
Thank you, Dr. Rabi and Oyun. My appeal is to all parents and guardians to have their children vaccinated with OPV and all other PPVs. Rest assured that the vaccinators are safe and free of COVID because of the precautionary steps that they're doing prior to deployment. And this is done on a daily basis and is part of their routine for safety and protection purposes. Likewise, all vaccines are proven over time to be safe and effective. Hence, there is nothing to be scared of. The vaccines are for your children's benefit and their future. Let us not deprive them of their right to be protected from vaccine-preventable diseases. With that, I'd like to thank Yusek Cosette and the DOH for having us here. Thank you very much and good afternoon.
Thank you very much, Yusek Dumama, Dr. Rabi, and Oyun for sharing your time with us and sharing your knowledge. Para naman po sa case bulletin natin ngayong araw na ito, makikita po sa inyong mga screen na mula po sa laboratory submissions kahapon na na-validate as of 4 p.m. today, July 21, ang ating active cases ay 45,646. Ang total confirmed cases natin ay 70,764, kung saan ang nadagdag sa araw na ito ay 1,951 cases. Sa mga newly reported cases, meron tayong 1,348 fresh cases at 603 late cases. Ang mga kasong iniulat natin ngayong araw ay mula po sa laboratory submissions ng 57 out of 89 licensed laboratories. Meron po tayong 209 recoveries na nakita at nai-report, kaya ang total recoveries natin ay nasa 23,281. Sa deaths naman, 20 deaths ang reported, kaya sa kasalukuyan po, 1,837 total deaths na ang ating naitatala. Sa 2 deaths na ito, isa po ang nangyari nitong July at isa po ang nangyari noong June. Sa 2 deaths na ito, isa ay galing sa Region 7 at isa ay galing sa Region 6. Ayon din po sa ating datos, ang ages po ng mga pumanaw sa sakit ay 49 at 70 years old. Kaya naman po ay inuulit namin sa ating elderly population, sa ating mga magulang, sa ating mga lolo at lola, na lalo po tayo maging mas maingat ngayong panahon ng pandemya. Marain po naming pinapaalalahanan ng lahat na mag-ingat, hindi po biro ang sakit na ito. Para naman po sa media questions natin for today, galing po kay Claudette Mocon Siriaco ng Business Mirror, while we continue to see a spike in cases, the amount of COVID-19 related medical waste may also increase significantly. How do we make sure that the implementation of medical waste management is strictly observed in the hospitals and quarantine facilities to control the source of the infection? Meron po tayong Department Memorandum 2020-0170 o ang Interim Guidelines on the Management of Healthcare Waste in Health Facilities, Community Quarantine Units, and Temporary Treatment and Monitoring Facilities with cases of COVID-19 para makapagbigay gabay po sa ating mga health facilities tungkol sa waste generation, segregation and collection, storage at transport and disposal. Nakasaad po sa guidelines na ito na ang mga health facilities katulad ng community quarantine facilities at TTMFs ay dapat sumunod sa mga rules and regulations na mandato ng Environmental Management Bureau ng DNR. Meron din po dapat sinusunod na magkahiwalay na waste route para sa pagtransport ng hazardous sa non-hazardous waste. Ang tamang disposal din po ng mga treated healthcare infectious waste ay dapat sa mga nakatalagang sanitary landfills. Kailangan po ang kooperasyon ng lahat upang masigurado natin na alinsunod sa nailabas na guidelines ang ating waste disposal. Ang pagsunod po dito ay makakatulong sa atin na malaki sa pagbawas ng pagkalat ng virus sa ating komunidad. Galing po kay Gerard Naval ng Malaya, Surigao del Norte Representative Ace Barbers has alleged that the real reason for the rise in COVID-19 cases in the country is DOH Secretary Francisco Duque's preference for the China-made test kits instead of the cheaper UPNIH test kits, saying the imported ones are not reliable and more expensive. What is the DOH's response to this? Is there a real preference for imported test kits? Are China-made test kits unreliable? Is there a plan for the DOH to strongly push for the use of the UPNIH test kits now that is already cleared for commercial use? Kami po sa DOH, katulong din po ang Department of Science and Technology, PCHRD, ay pinagmamalaki po ang ating homegrown scientist na patuloy na ginagamit ang kanilang talino at husay upang makatulong sa kapwa Pilipino sa buong mundo. We appreciate the Manila Health Tech team for their commitment to excellence and safety as they work closely with our independent laboratory expert panel in addressing key issues of versions 1 of Gene Amplify. Magmula po Abril ay nag-process na po tayo ng application but it was voluntarily recalled by the Manila Health Tech after finding contamination in the probes and primers of their product. Ang kagustuhan po ng kagawanan ng kalusugan ay para masigurado na ang mga test kits ay sumusunod sa mga standards at ang biosafety procedures ay naisagawa upang hindi po makompromiso ang integridad ng resulta at ng ating mga health personnel. Pagkatapos po ng ilang buwang kolaborasyon, kami po ay nagagalak na ibalita na ang Gene Amplify version 2, ang RT-PCR test kit ng ating bansa, ay nabigyan na po ng special certification for commercial use ng FDA at papayagan na po natin itong gamitin under specific conditions. Galing po kay Christine Sabilio ng ABS-CBN, ano po ang masasabi ng DOH sa balita na very promising ang clinical trials ng VCO laban sa COVID-19? Ano ang nangyayari kung mapatunayang epektibo nga ito? Ang COVID-19 ay isang bagong sakit, kaya naman maraming pang pag-aaral na ginagawa ukol dito, kabilang na po ang posibleng therapeutic interventions na maaring ibigay natin sa ating mga pasyente. We appreciate the efforts of various institutions conducting their own clinical trials as we look for possible solutions to COVID-19. Mas mainam po na antayin na lang natin ang opisyal na resulta ng nasabing clinical trial. Makakaasa po kayo na patuloy po ang pakikipag-usap ng DOH sa iba't ibang eksperto at technical working groups upang makapagbigay po tayo ng evidence-based policies and guidelines. Galing po kay Ron Lopez ng AFP, can gasoline be used as a disinfectant and what are the dangers of these to public health if they are used as such? Kung wala pong magagamit na malinis na tubig at sabon, inirekomenda po ng DOH at FDA na gumamit po ng alcohol or alcohol-based hand sanitizer. Ang mga alcohol po dapat ay naglalaman ng 70% ethyl alcohol or isopropyl alcohol, samantalang ang alcohol-based hand sanitizers ay dapat po naglalaman ng 60% ethyl alcohol or isopropyl alcohol. Kaya po 60 to 70% concentration ang required na ethyl or isopropyl alcohol dahil ito po ang mga may mabisang panlaban sa mikrobyo, bakterya at viruses. Nais lamang din po naming bigyang linaw ang isang social media post mula po kay Margot Salcedo na isang columnist ng Philippine Daily Inquirer na nagsasabing ang totoong bilang daw po ng positive individuals ayon sa June 20 situation report ay nasa 92,000 na. Kinaklaro lang po namin na ang 92,000 na bilang sa situation report noong July 20 ay base po sa outputs ng ating mga laboratorio sa buong bansa. Ilang beses na po naming naipalawanag sa past pressers na hindi po natin ginagamit ang numerong ito dahil po na sa deduplication at validation process na ginagawa po ng ating Epidemiology Bureau. Mahalaga po itong proseso na ginagawa ng ating Epidemiology Bureau bago maisama sa total confirmed case count ang mga numero sapagkat sa mga laboratory outputs po ay hindi tinitake into accounts ang duplicates at repeat tests within a laboratory at between different laboratories. As of July 20, nasa 68,000 pa lamang po ang ating total number of confirmed positive cases sa ating bansa. Sa post po ng columnist ay pinunto niya rin na tinatago daw po namin ang totoong bilang ng mga kaso by enlarging and highlighting the number of active cases. Nais lamang din po namin klaruhin na ang dahilan kung bakit ito ang ine-emphasize po natin ay dahil ito po ang mga active cases, ito po ang relevant at kailangan po nating bantayan. Ang number of active cases on a national and local level at hindi ang total number of cases ang ginagamit nating basihan sa pagdedesisyon kung anong klaseng measures and responses ang kailangan nating i-carry out sa isang lugar. At ito rin po ang ginagamit nating indicator kung paano natin i-adjust ang measures na ating ini-implement. Kung iisipin naman po kasi natin, bakit po natin i-highlight ang total number, malaking porsyento na po sa kabuuang bilang ay recovered na. Tinitiyak po natin na palagi na ang mga impormasyon po na inilalabas namin ay relevant na makakatulong sa ating mga kababayan sa kanilang pagdedesisyon at pagpoprotekta sa sarili. Hindi naman po nakatago ang total number of recorded positive cases dahil naka-include naman po ito sa situation reports at case bulletins na aming nilalabas araw-araw. Nais din lamang po naming ipaalala na bilang mga mamamahayag, may responsibilidad po tayo na ibahagi lamang ang tama at verified na information sa ating mga kapwa Pilipino. Bilang mga Pilipino din, lahat po tayo ay mayroong responsibilidad na tumulong upang mapigilan po ang pagkalat ng sakit na ito. Malalampasan po natin itong krisis na ito kung lahat po tayo ay magtutulungan. Walang dudang kailangan tayong laging alerto at mapagmasid laban sa COVID-19. Ngunit kailangan din natin maging mapagmatsyag sa iba pang mga karaniwang sakit na maaring dumapo sa atin sa gitna ng pandemyang ito. Ang ilan sa mga karaniwang sakit na ito, katulad po ng polio, ay nakakahawa at kailangan ng bakuna upang masugpo ang pagkalat nito. Mabuti na lang at meron ng bakuna laban sa polio. Ang kailangan lang gawin ng ating mga kababayan upang matiyak na ligtas ang kanilang mga anak ay pabakunahan ang kanilang mga anak sa pinakamalapit na health center. Habang sinasagawa po ang polio immunization campaign, mahalaga rin na ituloy lang natin ang pagpoprotekta sa ating mga frontliners at komunidad sa pamamagitan ng pagiging bida. B. Bawal ang walang mask. I. Iwasang hawakan ng muka at ang mga matataong lugar. D. Distansya ng hindi bababa sa 1 metro ay sundin. At A. Alamin ang tamang impormasyon. Maging alerto at matandain sa pagsasagawa ng ating mga safety protocols dahil ang bawat desisyon at kilos natin ay tungo sa pagpoprotekta ng ating sarili, ng mga mahal natin sa buhay at ng ating komunidad. Together, we can beat COVID-19 and together, we can be the solution.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Disaster Watch.